Hi, Mr. Merchant. My name is Neil Patel. I'm a medical student here. How are you doing today?
Doing pretty good.
Okay, so what brings you in?
I'm here for medication refills and a follow-up appointment.
Okay. Is there any other concerns you'd like me to address today?
No.
Okay. So I'll take care of the med refills before you leave. Before we do that, is it okay if I take a social history? Since you're a fairly new patient here, just for completeness of our records, we like to do that with all our patients.
Sure, no problem.
Okay. So, Mr. Martin, do you associate with any religion or spiritual sect?
Yes.
Spiritual sect?
Yes, I'm Muslim.
Okay.
Yeah.
About how much education do you say you received in your life?
I have my high school diploma.
Okay. Are you currently employed?
Yes, I am.
And where do you work?
I work at McDonald's full-time.
Okay. And can you tell me about your living arrangements?
I live in an apartment.
Do you live with anybody?
No.
Okay. Do you have any pets?
No.
Okay. Can you tell me a little bit about your diet?
What about my diet?
For instance, in an average day, what would you have for breakfast, lunch, and dinner, and snacks?
I'd say for breakfast I have cereal and eggs. For lunch, bagels or sandwiches or anything like that. And for dinner, it's pasta, probably something like that.
Okay. And you get any water in there?
Yeah.
Oh, okay. So the suggested is to drink eight glasses of water every day.
Okay.
Okay. Are you currently sexually active?
Yes.
Okay. Have you ever been tested for STDs in the past?
Yes, I have.
Okay. And have you ever tested positive?
No.
Okay. Do you use protection?
Yes.
Okay. So now, Mr. Martin, I'd like to talk to you about some specific questions about habits that can affect your health. These are a little bit more personal, but knowing about these things will help us to work together to maximize your health. Okay? So, do you use any tobacco products of any kind?
No, I do not.
Okay. And do you use any illicit drugs of any kind?
No, I do not.
Do you drink alcohol?
Yes, I do.
Okay. So, as we know, alcohol can have both positive and negative effects. And let's start about talking about alcohol first. Then.
Okay.
Okay. So, have you ever felt you needed to cut back on alcohol, on drinking?
Sometimes, yeah.
Okay. Have people ever annoyed you or criticized you about your alcohol use?
Yeah.
Okay. Have you ever felt guilty or ever felt bad about your drinking?
Sometimes, yeah, I have.
Okay. Have you ever needed a drink first thing in the morning to get rid of a hangover or to calm your nerves, to get going?
Occasionally, but not very frequently. Yeah, that happens though.
Okay. So, can you tell me about your pattern of alcohol use?
Okay. What exactly do you mean by pattern?
So, for instance, what type of alcohol do you drink?
I drink mostly beer, but occasionally whiskey. Sometimes.
Okay. And about how much would you say you drink?
I'd say about during a whole day, probably a 12-pack, 6-pack after work or so, and a 6-pack during lunch, something like that. Yeah.
And how often have you drank like this for?
How often? I probably around every day.
Every day?
Yeah.
And about for how long have you drank like this?
Probably around 10 years.
Around 10 years?
Around 10 years, yeah, something like that.
Okay. So, tell me some good things about drinking alcohol.
Well, it's just it's good for your social life. When I'm hanging out with my friends or just doing activities with them, just helps me loosen up and it just helps me enjoy my life more. Yes.
Okay. Anything else good about drinking alcohol?
Well, it also helps me meet new people. Like when I go out with my friends, especially, it helps me talk to girls because it helps me loosen up. It gives me more courage. And in general, I'm just a very shy guy, so it's harder for me to just approach and talk to girls. So it helps me in that case. And yeah, just in general, just loosens me up. Has a good time.
Okay. Anything else?
Alcohol. It's just I've been having some family problems recently, and alcohol has been like the only stable thing that's been there for me, and it's helped me cope up with a lot of difficulties I've had. So yeah.
Okay. Anything else?
No, not that I think of.
Okay. So what I hear alcohol is helping you enjoy life. It's helping you to meet people and taking away that inhibition, and it's helping you deal with some family struggles that you're going through. So can you tell me about some things that are not so good about drinking alcohol?
Yeah, definitely. I've been having financial problems in general, and drinking alcohol every day definitely adds to that problem because it's pretty expensive.
Okay. What else are some not so good things about drinking alcohol?
I've been getting really bad. Well, obviously, I realize it's not good for my health, but I've been trying, but yeah, and I've been getting really bad
Hangovers?
hangovers. Yes,
Okay.
hangovers the day after, and I'm sometimes just like throwing up, and I can't go to work sometimes. It hinders a lot of activities I could be able to do. So.
You want to give me an example of a hangover that you've had, or can you tell me what a hangover is exactly like for you?
Yeah, well, like I get like severe headaches, and I throw up, and then I just don't feel like getting out of bed, and then because of that, sometimes I miss work or something like that, and I get in trouble at work, and yeah, it escalates from there.
Okay. What else isn't or is not so good about drinking alcohol?
I guess I've been having it's affected my relationships because I had a girlfriend in the past, and alcohol has created problems between us in general.
So can you tell me specifically about what happened in that relationship, if you don't mind?
Sure. Just there was one day at work where I was upset with a coworker, and I just came home really drunk because I was really upset, and I just said certain things to her when I was drunk, and I shouldn't have said those things because it wasn't her fault, but obviously that created problems between us, and that causes us to break up.
Okay. Yeah. Sorry to hear that. You were also mentioning that alcohol has caused you some financial problems.
Yeah.
Can you tell me specifically about that?
Yeah. I generally I'm pretty good with keeping up track with money, but there's been a couple of instances where like I forgot to pay rent because I've been using the money on alcohol and buying alcohol, and there was a specific time where I had to ask my friend, I had to borrow money from my friend to pay rent.
Oh, okay.
Yeah.
Okay. So is there anything else that's not so good?
Well, I think that's it.
Okay. So what's your take on what we've talked about?
Well, after having this discussion, I realize there's a lot of negative things of alcohol, and I definitely think I should think about cutting back or some sort of prevention of alcohol.
Okay. So then is that your next step, cutting back?
Yeah.
Okay. So when people are trying to change their behaviors, they go through stages of behavior. There's 6 stages of behavior. 3 are implemented after you started change. And the 3 in the beginning are pre-contemplation, contemplation, and preparation. Meaning you're not intending to change in the next 6 months, you're intending to change in the next 6 months, or you're planning to change in the next month. Where do you think you stand?
I'd probably say within the next 6 months or so.
Okay.
Yeah.
And Mr. Martian, we have handouts and pamphlets here at the hospital
Okay.
that can give you information or give you assistance on how to go about drinking and cutting back. There's also many support groups, and if you'd like any information on that, I'd be able to provide you that.
Definitely. Sure.
Okay, so I'll definitely give you that.
Okay.
Also, on the next visit, would you like me to follow up with you and to see where you're at? Do you think that'll be helpful?
Yeah, I think it would be.
Okay, so I'll definitely do that. Alright, I'm going to get your refills. Is there anything else you'd like to talk about?
That's it.
Okay, thank you so much.
Thank you. Have a good day.